Hi, it's Tom here from Running Physio. Today I want to talk to you about something that most of our patients, regardless of whether they've got back pain, neck pain, knee pain, hip pain, will probably experience at some point during their rehab, and that's a flare-up in their symptoms. We're going to talk through 5 key tips on managing flare-ups so we can help to reduce their impact, we can learn from them, and hopefully reduce the likelihood of them recurring again in the future. Put a link to our selection of great free webinars on running injury. Do check those out. Lots of good information there on tendinopathy, on lower back pain, and lateral hip pain, all free and available for you to access via that link. Now let's talk a little bit about these flare-ups then. Often with our patients, when they're trying to get back to a goal activity, and it can be anything really, could be walking, could be daily activities at home, it could be their sport. One of the things that will prevent them doing it is experiencing a flare-up in their symptoms. And these can be very distressing for a patient, particularly if they don't recognize that they are a flare-up and that they've not actually caused themselves any new injury or damage. They can then prevent them from wanting to try again because they've encountered pain and they often think, well, I better stop, I better avoid that activity. So they can get in a bit of a vicious circle. However, if we have the right plan in place, we can often reduce the impact of these flare-ups, get them through it, and help them continue on that path of building up towards that goal activity that they want to get back into. So let's dive into 5 key tips to help with this. So number 1, the first key tip is to work closely with your patient to help them develop strategies to reduce pain during that flare-up, and wherever possible place them in control, because if they feel like they're not in control, that can be more distressing for them. So look for active strategies they can use. So it could be really simple stuff. Ice or heat. There is actually some quite good evidence to show that heat can be quite useful for reducing pain. Do they have some exercises that they can use? Do they have some simple analgesic options available to them? Do they have things like distraction perhaps, which can be useful? Engaging in valued activities that can take the focus away from pain. Because that can be a habit we get into during a flare-up. We focus on the symptoms, which tends to amplify them and make them worse. So strategy 1, work with them. Work with what they're telling you. What have they said are their easing factors? What seems to help them? And if we can get even just 2 or 3 strategies in place that they know that they can use when the symptoms are at their worst, it can help calm things down and make this flare-up much more manageable. So key tip 1, let's give them clear strategies to reduce their symptoms. Key tip 2, try and help people to stay active. Now, what I really often see with flare-ups is this pattern that people can get into where they build up perhaps too quickly, they have pain and they stop altogether. And they stop altogether sometimes for weeks, and then they go back to the start process and build up too quickly again. So that it stops them from making progress with their goal activity. So I'd in particular talk about what their goal activity is and how much of it perhaps they should be trying to maintain during that flare-up. Now, I sometimes find time ranges work quite well with this. So I'm working with a wonderful patient at the minute whose actual goal activity is sitting. She's got proximal hamstring tendon pain, and sitting has been very, very painful for her for several years. Now, what's happened in the past is she's built up her sitting time. She had a big flare up in her symptoms, so she stopped altogether and she's gone back to square one of literally a minute or 2 of sitting. So instead, we've said, well, let's work in a time range. So let's try and make sure that you stay sitting between about 10 and 15 minutes. So even on your bad days, you know you want to see if you can stick as close as possible to the bottom end of that time range so that we're not going back to square one. And we can then manage the symptoms that come with that, with our strategies to settle the pain. With her sitting, for example, can she be, chatting to a friend, reading a book, distracted and enjoying some other activity? Then the symptoms settle in a day or so and we're still where we are in terms of sitting. We can still then build again without going back to square one. So let's give people some clear guidance and reassurance that staying active is the way to go from it. So point 2, stay active, give people guidance, particularly on those goal activities. Point three, it's really important with a flare-up that as much as possible we learn from it. What has caused this flare-up? Why are things so sore at this point in time? And that's something to ask patients to reflect upon. And it may be that there's been a change in activity. Classically, we see it in our runners, don't we? They've suddenly pushed their running distance or intensity or added in an extra run, and now things are sore. That makes sense. But it isn't always the way. It can be inactivity. They've had to sit a lot longer for work. It might not be load related. They might be very stressed or very sleep deprived. So encourage them to look for those patterns and those causes of their flare-ups so they know what to modify next time, because otherwise they're going to keep getting in that same pattern and keep getting potentially in that boom and bust pattern where they continue too much of the aggravating factor, have a flare in symptoms, and then have to reduce everything and go back to the start again. Now, learning what your key aggravating factors are allows you to modify them and know what are the things that you need to build a little bit more slowly so that you can be consistent and develop over time. So point three, let's learn from it, see if we can identify 2 or 3 causes of flare-ups that we know we need to look out for in future. Point four, and this is one that I think I've only really thought about a lot recently, partly because of some really interesting comments from Derek Griffiths on this, is think about the psychological response to injury and psychological response to flare-up in particular. Now, I was chatting to a lady yesterday, actually, who was in acute flare-up of her symptoms. And I said to her, what do you think is the most distressing part of it? Is it the intensity of the pain that you have at the moment? Or is it what you feel about it, what you're thinking about it, your worry about it, and what it means for the future? And she said to me, well, actually, the pain I can cope with. It's not too bad, really, if I'm looking at the pain in isolation, but it's where my mind goes in a flare-up. It starts to think about, will it always be this bad? Will it ever get better? What does it mean for the future? Is there something missing here? So actually, for her, in a flare-up, it's the psychological distress that causes her the most problem, not necessarily the pain. And that's something that we can try and explore and look out for. And see then if we can develop a mindset outside of a flare-up that can be useful inside of the flare-up. So to recognize that this is a temporary change in symptoms rather than a lasting new sort of status for that person. To gather some perspective on it. So for that particular patient, for her to see how much progress she has made in her goal activities, and that actually this one very bad day was a one-off day when she hasn't had a flare-up in about the last 3 or 4 weeks. So we can gather a bit of perspective around it. We can recognize the progress we've made. And we can also decide, perhaps not in that flare-up, not at that time, to be engaging in making big conclusions about our pain. It's almost a bit like putting an out-of-office reply on your worry. You say, I'm not going to engage in really worrying and thinking about this and trying to decide where it's going at the point where it's at its worst. What I'm going to do is engage in valued activities that I enjoy. I'm going to make a deal with myself that right at this point, I'm not going to be making big conclusions about where I'm at. And then in 2 or 3 days' time, when it's settled and you're in a better mindset, then that's the point where you might reflect on how things are. So think about that, that kind of positive mindset that can be adopted during flare-up, ways to reduce the psychological distress. Sometimes as part of this, we might want to give people some almost like safety netting advice. What are the things that you need to look out for that actually warrant a change in your management or an action plan that needs to be different? Because having that clear guidance can help people. So let's say, for example, you've got someone coming back after a stress fracture and they're getting a bit of flare-up in symptoms around the area. And the symptoms aren't too bad, but they're really worried about them. What does it mean? What are the implications for me? Am I going down that route of a stress fracture again? Do I need to do something different? So we might say, okay, well, in that situation, if it's a mild flare-up in symptoms, but you're not too affected functionally, and if you don't have any of the key signs we'd be concerned about, like walking and weight-bearing pain, like visible swelling and bruising, like night symptoms, we're going to be a little bit less concerned about it. If you have some of those symptoms with it, give us a call, let's chat it through, and let's see if a different action plan is required. You could do something similar for low back pain. Central low back pain, even if it's quite severe, quite often can be a flare-up that can just be managed. But if you have those red flag signs, if you've got bladder or bowel disturbance, if you are developing any altered sensation, particularly, we know, of course, in the groin genital regions, those kind of things can be used as a guide to say, okay, when these aren't there, we don't need to be too concerned. It needs to be managed. When they are there, here's the plan that we're going to put in place. Here's who you need to contact. Here's what you need to do. And in the vast majority of these flare-ups, there won't be those red flag signs. There won't be those concerning things. So people can be reassured that it's a question of managing it and continuing on. So think about the kind of psychological side of it. Think about giving people some clear guidance of when different action is needed, and that allows them to know, okay, it's bad at the minute, but I can manage it and get back on track. Okay, so point number 4, think about the psychological response. And finally, point number 5 is create a flare-up plan with the patient. Or even better, get them to create a flare-up plan and write it down. Because when we're in a flare-up, particularly if it's a bad one and there's a lot of worry and concern about it, it's not very easy for us to be objective about managing it. Whereas outside of a flare-up, that can be quite a good time to actually say, okay, I'm in flare-up, this is what I need to do. These are my pain relieving strategies. These are the things that I need to do to stay active. These are the activities I'm going to need to modify to make me more comfortable. Here are my key signs that may require me to do something slightly different. Let's get it all written down. Let's get the resources I need in place for that. If it's a heat pack that you know is really effective for you, make sure you've got that to hand. If it's a particular type of pain relief that works for you, make sure you've stocked up on that. Because again, it gives a person control. They have a clear plan in place, and quite often it can lessen the impact of that flare up. They can get past it quicker and get back on track more quickly as well. Okay, so 5 key tips then on flare-up management. Let's just whiz through them really quickly to summarize. So point 1, develop some active strategies the patient can use themselves to reduce pain. Point 2, stay active, particularly with those goal activities a person's trying to do, but at a level they can manage. Point 3, try and learn from it and see if you can identify the cause. Point 4, consider the psychological distress that can come from a flare-up and developing a mindset and some strategies to help lessen that distress. And finally, point 5, put this together with the patient, get them to write it down in a nice, clear flare-up plan, particularly those patients that seem to experience flare-ups a lot. Then they're in control, they know what they can do, and they can hopefully lessen the impact of the flare-up and get through it a bit more quickly. Okay, thank you very much for listening today. As I mentioned at the start, we've got a link to those 3 webinars on lots of different running injuries. Do check those out. And I'd like to hear from you. What works for you if you have a flare-up yourself in some symptoms, or you're working with a patient who's struggling with repeated flare-ups? Are there any strategies that you find are very effective? Are there any key tips you think we should add to this list? Let us know in the replies and comments. I really look forward to hearing about that. And I'll be speaking to you again very soon. Thanks again for listening. Bye for now.